This is a very sad case of a young child with cancer that has serious implications for the family and the individual. I don't know if it's curable. But the reason I'm talking about this is because of a trajectory that I saw from the scientific community. And it was a post on LinkedIn that caught my attention that I'm sharing with you now because I am getting more and more worried about not just the fact that there seems to be a slow observation about unusual cancer presentations, but critically, when they start to link it to things that we really don't have a lot of strong support for. Now, I have to be very careful because I'm one of the people who is critical of the thinking of anything but the vaccine. And I have to be careful that when I am reflecting on things, I don't automatically make that association, and so do you. However, I don't believe that it should be taken off the table. And this is where I differ from many other people in the scientific community. So, what had happened, to give you some context here, I'll just show you the post that had happened here. And it was shared from a oncologist. And it's effectively saying in his 35 years, he had never encountered such a rapidly progressive case of a sarcoma in a 13-year-old child. And the child, who was previously healthy and active, suddenly developed shortness of breath, cough, rib pain, and the image revealed that the entire right lung was replaced with a tumor, pushing the heart to the side. And notably, it was the largest reported Ewing sarcoma. So, before I get into what I think, I thought I'd just give you a little bit of background into what a sarcoma is. So I've used the Mayo Clinic to give us some information here. And so the Mayo Clinic was saying is that a sarcoma is a broad group of cancers that starts in the bones and the soft tissues. So cancer can affect any cell type, and depending on the cell type that is involved will determine the name. And so sarcomas are cancers of the bones and the soft tissues. Could be anything: muscle, fat, blood vessels, nerves, tendons, lining of joints. And you can see here different names for depending on which kind of tumor, which kind of cell is involved. They specifically mention the Ewing sarcoma. And the Ewing sarcoma is a type of cancer that begins as a growth of cells in the bones and soft tissues around the bones, pronounced Ewing sarcoma, mostly children and young adults. It can also be the leg bones and the pelvis, and it's a pretty serious condition. And depending on where it is, will determine what symptoms it has. And I think critically, when you roll down, causes unclear. What causes it? Changes to the DNA. Sometimes risk factors: young age, European ancestry, and so it indicates that there is some genetic predisposition that exists with regards to a Ewing sarcoma. So that's the background that we have. Now, this now is the article that was done by the specific oncologist who has got a lot of years of experience. And so for him to come out with this is indicative of the seriousness or how unusual this presentation is. So what he then said, so this is an article that he did about it: possible link to post-COVID inflammation and turbo cancers. Now, this is a term that has been criticized by the scientific community, and it is very interesting that an oncologist has actually used this term. And as he was saying here, in his 35 years, he's never encountered such a rapidly progressive case of sarcoma in a 13-year-old child. And it came on quite suddenly. And I'll come back to his thoughts, but this is what the cancer looked like. So this is huge. So what you can see here is the chest cavity. These are the vertebrae in the back. And so it's a slice of a CT scan. The neck is up here. These are both shoulder joints. These represent the ribs on the side going down. And this black here represents the lung. The lung will show up as black in this sequence for the CT scan. The sarcoma is this huge mass here, this grayish area, and it's pushing the heart all the way across. And so this is significant. And what he had said is based on the size of this tumor, which literally is filling up more than the lung on the right-hand side and extending into the mediastinum. What he said is based on the size, notably, the largest ever Ewing sarcoma has been less than half the size of this case in terms of 3D dimension. So in effect, the largest reported cancer is half the size of this one. So this is in the category of never been seen before. So it's pretty serious. He then mentioned the term turbo cancers. Now, a lot of people criticize the term in the scientific community because they say people are making reference to turbo cancers and COVID vaccines. Now, I think that my description is that I think turbo cancer is not necessarily the correct term. And I'll show you what he said here. As he said, this raises the questions about the emergence of turbo cancers. And there has been a concerning 50% surge in colon cancer among individuals aged 25 to 49 since 2020. Okay? Now, the reality is there are only two options here, or three, depending on how you want to look at it. One is that COVID is driving all kinds of unusual cancers. My view is that if that is the case, I would expect that in areas of the world that has the lowest vaccination rates, this pattern would be the most obvious. So if you, for instance, looked in Europe, you would look at the country which had the lowest vaccinations rate, which may be Bulgaria, and look and see if they are having a surge of cancer. The other option would be to go to the other extreme of the elephant in the room and say that this is the cause of cancer, the surge in cancer since 2020. In order to corroborate that, you would want to look and see if this pattern is emerging in countries that are highly vaccinated. And if it is, it could be a pattern or a link. As I've always said, I suspect that a lot of it is due to a combination of the two, both infection in a population that is highly vaccinated. That's my thought. And what I'm concerned about is the fact that there seems to be an attempt to almost say it is not possible that there is a link with the elephant. So what you will notice happening here, and I'll show it in the article here, he done all the right things, 50% surge in colon cancer since 2020. Then here is the pivot. Is anyone paying attention to this trend? Some researchers are suggesting a possible link to post-COVID inflammation. Now, I don't have a problem with that link there, but I don't see how, from a scientific point of view, you can say this without including the elephant in the room. Now, I'm coming from it from the perspective of having done very heavy research in terms of long COVID. And just to prove my point, this here is the paper we've just submitted. I hope we'll get it through peer review. This is what I've been writing about with regards to long COVID and the reality of the disease and the complexity of the disease. So I've been looking at this for a long time. And if anything, people who have this kind of post-COVID presentation oftentimes have a hyperactive immune response, meaning that they are more likely, if anything, to overreact to things, including, therefore, theoretically, a cancer, because fundamentally, in order for cancer to occur, your immune system has to fail. And so, what I would expect is that even though they have higher immune dysregulation, if they have got ongoing symptoms, they may be actually more protected. But when you look at the points that he made here, points to consider, long COVID is now more costly per member. 4 million Americans unable to work. Long COVID sees lots of specialists. They're concerned about the chronic inflammation, which can be a cancer predisposition, rise in cancer stage migration, and looking at the demographics of long COVID. Now, as I said, we haven't really seen a flag that points directly to long COVID, even though some people are suggesting that infection may be a risk factor. But whenever they say that, my first question always is the infection in a cohort who is unvaccinated or in a cohort who has been elephantized? If you understand my mixing of the words. And the reason that's important is because you, yes, could have infection driving patterns if there is already immune dysregulation and immune priming. And that's the bit that I think gets very lost. Now, you may think it's only him, okay? And I'll show you what I said, because I then reshared that post. And here was my comment at the time. Really important acknowledgement. The oncology community has been relatively silent about this unusual transition of cancers post-pandemic. They're far more aggressive and spread much earlier. However, linking it to long COVID is a mistake based on my research. Usually, these individuals have a hyper-responsive immune system, which is the main predisposition for persistent immune dysregulation and symptoms. Conversely, long COVID symptoms primarily initiated and exacerbated by certain COVID interventions, I can't say the word, would be far more likely issue because of probable cellular interference suppression. The first step is to acknowledge it, which is what they've done, and then research for specific associations. So again, I have been very careful in what I have said, because I can't at the same time go to the other extreme of saying that it's definitely this. What we have seen, and so let me define for you what they mean by turbo cancer. It seems to be, one, the cancers do seem to be growing faster. Okay, as you've seen with that case, that cancer must have been growing for some time. Two, it seems that the response to the tumor seems to be less. And so people seem to have less symptoms when they have a cancer, which is why it appears to appear suddenly. Cancer never appears suddenly. It's just that there were no symptoms until something happens, they get a scan, and then they've got cancer. And three, it seems that the cancer is spreading, metastasizing far earlier than it used to. Normally, cancers would go through a number of stages: stage 1, stage 2, stage 3, spread to the lymph nodes, and then from the lymph nodes, it spreads to distant organs. And we almost seem to be seeing a jump where, when it's going from stage 2, it's not just going to stage 3, it's going to 3 and 4 at the same time. And that therefore means that metastatic disease, advanced cancer, may be the first presentation that some patients have. And at that point, the horse has bolted. Cancer can't work. Chemotherapy is only palliative, and everything is just supportive at that point rather than curative. So it is a very, very serious point. So then we come to the other part that really concerns me. When he made the point, and if you're just if you're just joining us now, this is the cancer in a 13-year-old child. Huge, probably the biggest he's ever seen, probably the biggest ever reported. almost twice the size of anything else. All of this gray area here represents the cancer. This is the normal lung, and it's pushed the heart across to the side. Now, what stood out to me more was some of the responses. Now, this is somebody who said it straight up. Are we all pretending to not understand basic biology, ignoring the fact that people were injected? Perfect. Now, you don't want to go to the other extreme saying this is the only cause, but absolutely have it in the picture. As he said, the elephant is in the room, is now a mammoth, and still seems invisible. And what you will notice, however, and somebody again asked this very obvious question: did that child receive that? I mean, this is an important question, but we probably would never know. Um, but then people talk about the autoimmune issues. People are talking about the fact that we need further scientific rigor with regards to aggressive pediatric sarcomas. Um, Somebody is making the point here that the virus is carcinogenic. So this is where I'm worried, is that they seem to be drifting all possibilities. And looking at this serum biomarkers, how we should be looking for long COVID as predictive of cancer. And so you can see the scientific community has taken a specific position that they no longer think that it is needed for us to consider the elephant in the room. I I think that is very, very dangerous, because I have not seen enough evidence that would warrant anybody realistically saying this is not the case. We've seen data from Italy and Korea that clearly has a trend and a flag, but it seems as though this is going under the table. It's not yet being recognized. And what it means is that we are going to have a longer time for the medical and the scientific community to recognize this issue and to actually ask the specific questions and to look in a detailed way at who is having these presentations, what was their status, and trying to understand how we can therefore identify who else may be at risk. Because here is the final point. Some people think this is just about challenging the narrative, identifying the perpetrators, and a Nuremberg trial or something. From my point of view, this is quite clinical, because most of the work that is done in medicine is about identification, prevention, and treatment comes when people have fallen through the cracks. We don't wait for somebody to have a stroke to realize that they have high blood pressure. That's not what you want to do. You want to know they've got high blood pressure. You want to try and mitigate the risks. And even if they had a stroke, at least you would have hopefully reduced the severity of it. So a lot of medicine is about identifying risk patterns, who is at risk, finding ways, if we can, to mitigate it. It may mean that you need more frequent cancer surveillance on a specific cohort. This is why people have colonoscopies. If they have known bowel cancer in the past, you would then do more frequent colonoscopies. It's that kind of work that needs to happen. But what the problem at the moment is, nobody is willing to step up and point out the elephant in the room. It is the perfect description of that story we knew as a child of the emperor has no clothes. He was wearing nothing. Everybody in the crowd was staring at him wearing nothing. Nobody said anything because everyone was afraid to be the first person to say you are not wearing any clothes, because they would then be targeted as being unbelievable. I can't believe you said it. It took a child to point out that the emperor has no clothes. And then everybody goes, oh, yes, you're right. He really has no clothes. This is where we are today. And every day that is lost is making it harder and worse for the public, the patients, the loved ones who have to face this. We, in my view, are failing them by being afraid to ask the hard questions. Hopefully, things will get better in time. But by that stage, not only would the horse have bolted, but it would probably have reached to the other side of the country. We still have a long way to go. Have a great evening.
A hero, an immune adventure. Humming Heroes, your lyrical guide to the body's defenders. Now on Amazon. Check the links below.